This year's theme, I am and I will, acknowledges that everyone has the capacity to address the cancer burden. The theme also affirms that we can all be responsible for reducing the burden of this scourge, and it need not be a death sentence anymore. Many nations have made significant progress, and survival rate is climbing higher for them. We are putting strategies and funding in place in Nigeria, albeit too small according to experts, but all seem so little to achieve that significant impact that patients, survivors, and all Nigerians are expecting. How can we reduce the burden of cancer or mitigate its devastating effect? Moving forward, we need to create a cancer-free society. How do we go about it? What do we need to put in place, or what should we add to what is in place? That's the focus on Bridges today. Welcome, I'm Mujima Controller. Now, quickly, let me introduce our guest on the program. Here with me on set and applying the COVID-19 protocol, so we are 6 feet apart. I have with me Dr. Alhassan Umar, public health physician, who works with the Federal Medical Center in Unguru, Yobe State. That's from the end of Nigeria as it is, but he's here with us in just to ensure that the fight to conquer cancer is put in perspective. He's also the president and chief executive of the Nigerian Cancer Society. Dr. Umar, thank you for coming.
It's a pleasure to be here, and thank you very much for having me.
Yes. I also have here with us a chief advocate. I call him an advocate. He's a medical doctor, but he's an advocate, and we all work together on these moves to ensure that we reduce the burden of cancer in Nigeria. Dr. Laz Eze is here with us. Dr. Laz, you're welcome on Bridges, and thank you for your time, because I also know that you also do a lot in the health communications and giving visibility to all kinds of health issues. Thank you so much for coming on Bridges.
Thank you very much.
And joining us from Lagos is Dr. Ladi Hameed, who wears two caps. And I don't know how he does it, but he has a way of juggling it. As a medical practitioner and the head of the leading pharma company involved in the cancer fight. And he's going to be sharing experiences with us, because one of the greatest of the burdens that cancer patients or families have to live with is the high cost of treatment. We'll come back to you. Dr. Hameed, thank you for joining us. You're welcome. And how is Lagos?
Very fine. Thank you very much for the invite.
Okay. Yes. We have a survivor here too, who is going to join us and share her experience with us. Like we said earlier on, cancer doesn't have to be a death sentence. So we have the survivor here, Miss Gloria Okon will join us at some point, and a carer, somebody who had to look after two of her relatives who had cancer. What is the effect of these cancer patients on the family? These are all the things we hope to bring together here as we build a bridge that we hope will have a cancer-free society or cancer-reduced mortality as we go on. So let's start with you, Dr. Hassan, and just share with us. I know throughout the week, that gone by, you had been, saying so much about cancers, and this is our own contribution to the World Cancer Day. So let's look at cancer in all its ramification, and quickly just give us, what is the situation in Nigeria now?
Well, thank you very much once again for having me. Well, you see, the activities that marked this year's World Cancer Day are quite instructive, in the sense that the I am and I will theme for this year has been a global driven campaign that started in the year 2019. It has been the theme for the past 3 years, which we started in 2019, 2020, and then culminating in 2021, with the central focus that together all our actions matter. Now, together all our action matters.
What matters?
Indicates that everybody is a stakeholder in the fight against cancer. Everybody is a stakeholder in the prevention and treatment of cancer. Everybody is significant and important in making contributions towards ensuring that we have a Nigeria free of cancer, we have a world free of cancer, we have very few people getting cancer, and we have fewer people dying from cancer, and those that are already affected by the disease have a better and good quality of life. Well, in Nigeria, a lot has been done, but the problem we have is that purposeful approach at having an all-encompassing movement, an all-encompassing decision to really face this monster head-on. And this is the reason why we are trying as much as we can from the advocacy side to raise the awareness, to increase on our advocacy engagements so that government and all relevant stakeholders in the cancer space will come together, have a formidable front so that we can make impact towards reducing the burden of cancer.
I'd quickly like to go to Dr. Laz. Dr. Laz, I hope you're there with us. You're still going to come. I hope you can join us, or you are with us already. Dr. Laz, thank you. Dr. Laz, how can we reduce the burden of cancer or mitigate its devastating effect? We're talking to universal health coverage. How can we as a people, within the context of the theme, I am and I will, ensure that we reduce the burden of cancer? Dr. Laz, you're on.
Thank you very much, Ma. Yes, along the theme, I am and I will, which seeks to get individual commitments from everybody towards reducing the cancer burden and, of course, enhancing utmost survival. We can do this first through education. By educating people, it helps people to know the cancers that are absolutely preventable and what they need to know to prevent it. And even those that we may not be able to prevent with minimal the efforts we make, we'll be able to detect them early, and also know the right actions to take when those early signs begin to show. And also encouraging good health-seeking behaviors, because it's been shown that some persons die from cancer not even when they detect it early, but because they did not adhere to the treatment protocols. And health financing is key. You mentioned universal health coverage. Having worked with a lot of cancer patients and having led a foundation that did domestic resource mobilization to supporting cancer care, I came very close in contact with the various challenges that people with cancer go through. We have different categories of persons, majority who don't even have enough money for out-of-pocket expenditure to get themselves treated. But even among the few that has the money to treat themselves, our facilities are also grossly inadequate, both manpower, equipment, and all of that. So the very few that have money, many of them still have to go outside, and those who can't go outside experience a lot of delays, that even early diagnosed cases and those that commence treatment early may still get delayed from the inadequate facilities and delay their treatment and still get to kill them. So, but I believe that universal health coverage, health insurance that covers everybody, is going to encourage more private sector participation and investment in cancer care.
Well, some cancers are preventable. I'm going now to Lagos and I'm going to Dr. Ladi. Dr. Ladi, if you're down with cancer, you need, of course, medication. And sometimes patients are not able to afford, or even they start and at some point they stop medication. You work for a leading pharma company who is involved in cancer, in the cancer fight. Let's hear your thoughts on this. how can we make medication available and affordable for people who need them? You're joining us from Lagos, so you have the mic now, Dr. Ladi.
All right, thank you very much, Muji. I think Dr. Umar and Dr. Las have touched a bit on some of the issues we have with cancer. And I think the main challenge is not at the end point, which is medication. I think it really starts from the beginning. When we talk about the patient journey or the steps a patient has to take from awareness to even making an accurate diagnosis, and then finally coming to radiotherapy, chemotherapy, and other specialized medications that the patient should use. None of those steps should a patient have to pay out of pocket. The cost of radiotherapy, cost of chemotherapy, cost of medication should not be borne at the time of a diagnosis or the time of need of a patient. We need to have what we call a strengthened insurance system, whereby that treatment for cancer is properly covered and citizens of the country are encouraged or mandated to partake in an insurance system, so that it is not when you need treatment or you need accurate diagnosis, then you need to start running around looking for the funds to pay for that treatment. No system in the world works like this. It needs to be an insurance system that can actually alleviate the burden of cancer in the population.
Yes, thank you so much, Dr. Ladi. I'd also want to speak to you on the cost of medication too. Well, because finally, when you're tested and you're diagnosed, how can you keep up with the cost of medication? What should be happening?
Now, if there is an insurance system that covers 80–90% of the population, then the cost of the medication should be brought down as low as possible, because you have the multitude of volumes there. Now, in the reverse way we have in Nigeria, where a patient has to go and buy 1 vial or 2 vials, clearly the cost of medication is not ideal in a situation like that. Now, what we have in Nigeria is a lot of bodies who are supporting patients to pay for the cost of medication. And you also have a lot of organizations like mine who are looking for innovative ways to make medication more affordable. Other things are tax incentives and waivers by the government to ensure that we take away some of the costs that are added on the cost of distribution for medication. Those are ways that if we take away some of those levies and taxes, we can bring down the cost of medication. And then when we get a larger volume and coverage for patients, then the cost of the medication will be significantly dropped.
Thank you very much for that. And I know you want to jump on that conversation.
Oh, yes. Oh, yes. Thank you very much, Dr. Ladi, for that very insightful expose on the issues. You see, cancer prevention care involves a lot of things. And significantly, the 3 A's, as rightly highlighted by Dr. Ladi, are very, very significant. Accessibility is one. You have affordability and the availability, because these are issues that are seriously bedeviling us in this country. You discover that the level of awareness is low, a lot of misconceptions and myths going around, thereby making victims to come to the hospital at very late stages. In fact, in some stages at terminal stages, because they say when you have cancer and you go and have an injection in the hospital or surgery, you will die. Because what actually kills the patient is not the injection or the surgery, but rather the advanced stage of the surgery.
So presentation is late.
It is late.
And coupled with the fact that high cost of treatment when eventually
yes,
you show your
yes,
face.
Yes. And let me re-emphasize here also. You see, most cancers are preventable. One third of cancers, most cancers are preventable. And according to statistics, another 1/3 is curable if as highlighted by my senior colleague, if detected early, an appropriate treatment is given.
Now, I'll go to Folu Duke. Folu Duke, unfortunately, lost relatives to cancer, like I did. I lost my auntie to cancer, and I knew that it affected everything about us, finances, emotional stress, and all that. But let's hear from Folu. Folu Duke, are you there? Yes. Okay, Folu, let's hear from you.
Living with your patients with cancer can be very, very destructive on everything you think you have or that you hold dear. And we've not really looked at it holistically, because for anybody who is in his prime or above his prime, the nation has invested a lot in that person. And for us to lose them to cancer means that we have wasted our investment in that human life. It shouldn't be allowed to happen. When you invest in a person, the person is valuable to society and should be a valuable contributor. We should not allow cancer to claim them. If we are looking at health insurance, we have a huge population. We should take advantage of it. We have over 200 million, and we are told we have a young population of about 65%. But if you look at the adult Nigerian that can afford something, let's even start by saying every adult Nigerian should pay 100 naira monthly. That gives us about 10 billion to put into health every month. And it can go a long way in 1 year. We shouldn't look at it that way. So let government think seriously. We're paying lip service to health insurance. We've not done much about it. We need to get everybody on board. And that's the only way we're going to be able to tackle cancer. Beyond that, when we're thinking of creating a future that's free of cancer, there are practices we have now, especially hygiene practices, that predispose us to cancer. One thing we see around the abattoirs now is that they burn the meat we eat, the skin, and even part of the beef with plastics that emit dioxin on those meat they are burning. That's a potential. I'm not an expert, but I believe dioxin is dangerous to health. And that's what we encourage. We've not looked at it. There are many things that we need to look at if we are really going to get rid of cancer for the future.
And so for cancer treatment, it's not easy at all. We have very few oncologists. Most of them have left the country due to poor working conditions. And the ones that are around are clearly overwhelmed. And then when you talk of equipment, beds, for example, so when you go to a chemo ward, you have to stand in queue because the beds are very few. And things like machines for radiotherapy, very few in the country. People travel from very far places to come for treatment, and they end up sleeping in mosques and churches and becoming an inconvenience to their relatives. And then the cost of treatment is very, very exorbitant. The cost is enormous. And so many people have stopped treatment because they can no longer afford it. And some of us that could do our treatment, we have to turn beggars, We have to, talk to people around us, our friends, our colleagues, our neighbors, church members, everybody had to start donating money for us to be able to afford the treatment. So treating cancer in Nigeria is a very huge burden. It's a very big burden. And I really wish the government could do something to ease that burden for us.
Going forward and building a sustainable bridge to reduce the cancer burden in Nigeria. Dr. Ladi, what are your final words?
So when we talk about affordability, it shouldn't be affordability from the point of the patient having to pay. Because in the richest countries in the world, patients do not pay for medication out of pocket. It is not possible, it is not sustainable. Now, the myth and the fear of cancer comes from the point, and really sad to hear the experiences you're sharing and also from Folu, on the financial burden on families. But there's also the fear of people saying, I will not go for a check because I don't want to have that disease. But it's because they do not see an end in sight. So we truly need not just awareness, but we need diagnostic and treatment coverage, some kind of insurance system. Then patients will not be scared to go for early diagnosis. or screening tests because they know there is a path for curing them.
Thank you very much. Dr. Laz, final words.
Thank you very much. Like I mentioned earlier, education is key, and I absolutely agree with Dr. Ladi on the universal health coverage and not allowing cancer patients to make out-of-pocket expenditure. And I also want the professionals to know that we are grossly underserved, both in terms of the number of oncologists for our population, even nurse oncologists, mental health physicians. I would really like to have more mental health concerns, psychosocial support for persons with cancer. You know, we need more clinical psychologists in the system and multidisciplinary approach in the way we care for cancer patients. There is a lot of vertical approach in the care, but we need to integrate it and have a team. And at the state level and local government level, I think there is need for there to be more political will, especially in creating awareness and diagnosis.
And from you?
Yes, thank you very much. I am totally in agreement with the deposition by Dr. Ladi on universal health coverage. It's a good thing that the National Health Insurance Scheme has some coverage for cancer, but what we need is a holistic approach whereby everything will be taken care of. And very importantly, let me state here that some states are doing very well. Kebbi State is an example. And recently, Kano State. And so many states are coming on board with their state health insurance schemes. And this is the time that we all need to come up, we all need to do the needful in order to reduce the burden of cancer. And again, collaboration is the only way forward. When we collaborate, we bring the matter to the front burner, it will keep going. The Nigerian Cancer Society and its partners with the Nigerian Medical Association and the Africa Health Budget Network, in commemoration of the World Cancer Day, held activities jointly. And we kept on re-echoing these matters. We kept on re-echoing these issues. And definitely we will get there. But it's not yet Uhuru. Thank you.
Thank you very much. Yes, we are not there yet, but we can get there. And thank God this is Nigeria. And everyone that has spoken to you are, experts in country. And I think that more than anything else, we should be looking in country for things that can be done, because those are more sustainable than others. Well, partnering and of course learning new skills and all that is important. We have been able to build a bridge that we pray that will be one that will be able to reduce the burden of cancers. We've spoken to human resources. The experts are needed. We have spoken to the fact that a lot of noise must go around, visibility must go around to reduce the fears and anxiety of people who unfortunately are affected. And also experts have spoken to us here that some cancers are actually they are preventable, some are treatable, but ultimately what is needed is to have early detection. They say save small lives. And that's on that note, I'd like to wrap it up. I mean, we could continue to talk to these. Thank you, Dr. Ladi, joining us from Lagos. We'll continue to build the bridge, and we'll always knock on your door, because this is not going to be a one-off. It should, as far as I'm concerned, World Cancer Day should be 365 days until, of course, we are, particularly in our situation, until, of course, we are able to reduce the burden and, of course, the high mortality associated with it. Dr. Laz, thank you. We'll go back to the field. We ensure that when we pass these messages, we speak to our people in the languages they understand. That way, we will remove the myths, we'll remove the anxiety, we'll remove the fear, and most importantly, let funds be made available so that patients can access and afford, as it were, not out of pocket, but a system that will be able to make life and the burden easy for all of us. I want to thank you, all of you, for joining us today. I will not say happy cancer. I would say that may we together, as the theme says, I am and I will reduce the burden of cancer in Nigeria. That's it on Bridges. Thanks for watching. We'll be back same time next week.